Hi, I'm Dr. David Ross. I'm the director of the Virginia Institute of Neuropsychiatry, and I want to tell you today about some research that we've done with patients with traumatic brain injury and structural MRI brain imaging using software called NeuroQuant to measure the brain volume. We call this talk Back to the Future, Estimating Pre-Injury Brain Volume in Patients with Traumatic Brain Injury. The goal of this talk was to try to measure or at least estimate the volume of the brain in patients with traumatic brain injury the moment before they had their traumatic brain injury. Because that's what we really want. That's what we'd love to have in this field, is a measured brain volume just before the accident. And we almost never have that, unfortunately, because we don't know when the patient's going to have the accident, and it's not practical to screen everybody with MRIs and give everyone MRIs in case one day they might have an accident. So in this study, we developed a method to estimate the volume of the brain just before the moment of the accident. And we had some interesting findings when we compared that to brain volume after the accident. And the findings seemed to be unique to traumatic brain injury and seemed to allow us to form a test, a diagnostic test, which could distinguish patients with mild or moderate traumatic brain injury from normal control subjects. So that's what I want to tell you about, and this is how we did it. This study was built on many years of research by other investigators. The most recent one that got us excited and led to our study was a study reported by Dr. Hedman and colleagues, in which they did a type of meta-analysis of many other studies looking at the change of brain volume over the normal lifespan. And in this figure here, you can see one of their summary figures of their work and their brain volume model. So this graph here, there are 55 gray circles. Each gray circle represents one study that they included in their analysis. The center point of the study is at the age of the mean age of the normal control group that they studied. And the size of the circle is proportional to the number of normal subjects in the study. So they mapped all these studies of change of whole brain volume versus age of the subjects. And then they did curve fitting to map out normal change of brain volume over the lifespan. You can see the red curves show the curve fitting. They did have a bit of a limitation around age 22. They didn't have enough data to make the curve smooth through that area. We're sure in nature there would be a smooth curve there, but they couldn't make the curve work because there wasn't enough data. So their solution was to do two curve fits, one for ages 9 to 22 and a second for ages 22 and older. But because this study is based on so many other studies, which, by the way, included a total of over 2,000 normal control subjects, this provided a roadmap for normal change of brain volume over the lifespan, something that's very valuable. And we decided we wanted to use that to help us understand changes in brain volume in our patients with traumatic brain injury. One of the next things that Dr. Hedman and colleagues did was to enter into this model a starting value for brain volume. And they used data from a study by Dr. Pepper et al. On 9-year-old twins. And they entered the brain volume for those twins, which was approximately 1,325 milliliters, which is also cubic centimeters. Once they knew the starting value, and then once they knew how much the volume would change each year, getting bigger or smaller each year, using their curve fit results, they could plot out over the lifespan what the normal volume of the brain would be. You can see that in this graph here. From childhood through teenage years, there's growth of the brain, reaching maximal brain volume at around age 13, which, by the way, is not the age at which you have greatest intelligence, but as a father of teenagers, I can tell you it is the age at which you think you have the greatest intelligence. Then there seems to be a little bit of pruning of the brain and some slight decrease of volume around age 20 or so. But then the volume increases again during the 20s up until about 30 or 35. And then the volume drops off a little bit in the 40s and 50s, and it drops off at an even faster rate in the 60s and 70s and older ages. So this is what the normal change of brain volume looks like during the lifespan. We then applied this to our own sample of normal control subjects, which you can see in this graph. We took as a starting value the mean brain volume of our normal subjects, which happened to be 1,102 cubic centimeters, at their mean age, which was 68 years old. And you can see we plotted the starting value there. We then did something very, very similar to what Hedman did for their normal growth plot. And by integration, we calculated the years before and after our starting value to determine what normal brain volume would look like using our methods based on our MRI scanning and NeuroQuant software brain volume measurement methods. And you can see how the shape of the curve here is essentially identical to that of Hedman and al.'s similar graph. Our next step was to map onto this graph brain volume measured as a percentage of intracranial volume. The reason we wanted to do this was because we want to apply this to our patients with traumatic brain injury. And the problem of trying to apply it using simply brain volume measured with cubic centimeters is that our patients, we know, don't have normal brain volume because of their injury. So we can't simply use an MRI scan taken after the injury and measure their brain volume to know what happened before the injury. But we can use their intracranial volume because work by Dr. Tate and colleagues, which was based on earlier work by Dr. Blatter and Dr. Bigler and colleagues, showed us that you can use intracranial volume to predict someone's whole brain volume. And this is how it works. Early in life, as we saw a few slides ago, your brain grows rapidly. Well, your skull grows just big enough to cover your brain, basically. Then later in life, as your brain shrinks, your skull stays the same volume. In fact, your skull stays the same volume your entire adult life. So we've known for years that you can measure intracranial volume later in life and use it to predict or estimate your maximal brain volume earlier in life. Well, by combining the Tate model with the Hedman model, you get a powerful combination because now using intracranial volume measured later in life, we can not only estimate maximal brain volume earlier in life, but we can estimate brain volume at any point during the lifespan from early in life to late in life. And that's what this graph shows you for our normal control subjects and our MRI and NeuroQuant-based methods. We map brain volume measured as a percentage of intracranial volume on the right axis, with whole brain volume measured in cc's on the left axis. And for our normal controls, the data turned out this way because their intracranial volume was 1,527 cc's at the starting value. Therefore, their percentage of intracranial volume was 72.2% at that starting value. Then our next step, in order to use percentage of intracranial volume as a bridge to be able to apply it to our brain injured patients, was essentially to remove the axis on the left. So now in this figure, we're no longer talking about brain volume measured in cubic centimeters. We're talking about brain volume measured as a percentage of intracranial volume. So the graph you're seeing here would apply to any normal subject we measured with our MRI and NeuroQuant methods. And during the lifespan, with our methods, this is what your percentage of intracranial volume is going to be throughout your life. So for example, if we take a subject, let's say it's a normal subject, and we'll call him RG. And if we wanted to know, using our methods, what his percentage of intracranial volume is going to be at any point during his lifespan, his data would map on directly onto the normal control data that we just looked at. Now in this graph I've offset it slightly so that you can see what we're talking about for illustration, but in reality it would be exactly overlapped on the normal data. So that's pretty straightforward. Now for our next step, as you can see in this graph, we've put whole brain volume measured in cc's on the left axis back on the left axis. And we've removed percentage of intracranial volume on the right. And our subject RG, his whole brain volume on this graph is shifted upward. Now why would it be shifted upward above our normal control data graph? That's because his intracranial volume was larger than the mean value for our normal control data. So his intracranial volume was 1,546 cc's, and that was larger than the mean of our normal controls, which was 1,527 cc's. So he had a bigger skull, therefore he had a bigger brain. But you can see that his curve parallels the normal curve throughout the lifespan. So we've used the percentage of intracranial volume as a bridge to get to his whole brain volume measured in cc's. Then we tested the reliability of this integrated model by taking each of our normal control subjects, and we had 20, and testing them individually in two different ways, independent ways. One, we measured their brain volume directly. Two, we took only their intracranial volume and we estimated their whole brain volume based simply on their intracranial volume. Then we did a correlation to see did these two match up. Ideally they'd be exactly the same. Well, we found that they matched up very well. Not exactly the same, but very well. And here's a graph of whole brain parenchymal volume measured in cc's versus whole brain volume estimated in cc's. The diagonal dotted line here would be a perfect match. And you can see that the data of our normal controls lined up very well with an interclass correlation coefficient of 0.95, which is in the excellent to outstanding range. So we were encouraged by this and felt confident to go ahead and apply this to our patients with traumatic brain injury.